Well, good evening, everybody. Thank you so much for joining us for this lymphatic drainage workshop with Caitlyn Nguyen. I wanted to start off by introducing Caitlyn and just thanking her for sharing her knowledge and her wisdom and her passion about manual lymphatic drainage and lymphatic enhancement technology tonight. So, just to give you some background on Caitlin, she is a second generation certified massage therapist and a holistic health practitioner. She graduated from Healing Hands School of Holistic Health after transitioning from the field of international education to holistic healthcare. After she received her bachelor's degree with honors in integrated educational studies and leadership studies from Chapman University, she was awarded the U.S. State Department's prestigious Fulbright Scholarship to live and teach in northern Vietnam. While abroad in Asia, she was first exposed to the utilization of acupuncture and traditional Chinese medicine techniques in their healthcare systems. Caitlin specializes in manual lymphatic drainage massage, structural organization, and myofascial release. Manual lymphatic drainage massage is a light touch modality and encourages the body to expel excess cell waste, fluid, and external environmental toxins in order to reduce swelling and to also boost the body's natural immune system functioning. She also offers structural organization and myofascial release massage, which is a deep, intensive body analysis that examines the way patients live in their bodies and reorganizes the body from the foundation of the feet up to the head to restructure the entire body to exist in its most efficient functioning. In addition, Caitlin has also received training in traditional massage modalities, including Swedish massage, deep tissue, Tui-Na, Shiatsu, Reiki, and dynamic cupping. So, Caitlin has been working with us for over 3 years, but has been with us as a massage therapist for almost a year. And it has been really amazing to see how effective her treatments are, especially when integrating them along with acupuncture and chiropractic care. So we've been able to really see such an improvement in our patients for different things, whether they're going through some fertility treatments or if they have some immunity issues or chronic pain. Caitlin has been a really great resource of healing for our patients here at Revive Chi. So we are really thankful to have her on our team. Caitlin, we would love to hear a little bit more about your background and how you got into massage and lymphatic drainage. And if you could tell us a little bit about your journey and how you stumbled upon lymphatic drainage, because it's such a specialty, I think, within massage.
Yeah, well, thanks for your intro. Um, Massage for me has always kind of been like a part of my childhood and upbringing, but something that I almost like never considered for myself. My uncle is actually a massage therapist, and I was very studious. I don't know if you could tell based on my like degrees and everything. I was very all about studying, and it never occurred to me to do this type of work. I have a family full of doctors, Western and some acupuncturists in the family. I never thought I would be in this field, but I decided one day, like post-pandemic, that I needed something that made me feel like this purpose in my life, and I decided to go to massage school. And I was like, I'll just take like a class a la carte, and I took the one class, and I was like floored by how much it connected to me and the type of healing I think I've always wanted to help people find. And I say that that way because it's not like I give you the healing. It's like what's really nice about massage therapy is we kind of like facilitate your own type of healing. And so a lot of it is like a bodily awareness and just connecting to yourself again. And that's something that I think I really connect to as a healing modality. And it was so funny that like that first day of massage school, I was like, I gotta figure out if I really want to do this. And then they were like, oh, the lymphatic class is starting like this weekend. And I was like, I don't know why, but I must take this class. I'm gonna commit to the whole program. And I did, like right there. And it was actually because of the lymphatic class that I went for like the extra long program. and went ahead with it. And there's just something specifically about lymphatic drainage that I was like, yeah, this is the stuff I want to do. Um, it's it's very like it's very clinically studied in addition to having like um a very subtle energetic like connection to like the movement of the fluid in the body. And I think that might be like the sweet spot for like massage for me as a therapist. So that's something that I really like kind of delved into. And this actually wasn't included in my bio, but eventually I started learning pre and perinatal massage. So nowadays at this clinic at Revive, I'm doing a lot of the lymphatic and I'm doing a lot of pre-perinatal, and then also like the therapeutic massage, like the structural organization and myofascial release. So yeah, that's kind of like my background with it and like my passion for it. It's just
Well,
want to make everyone feel better,
I
you
love it
know?
when the universe has a plan and you just follow it, right? You're like,
Yeah.
I need to take this extra class, even though it's going to extend my program even longer. So
Yeah.
we're so grateful that you did because, the lymphatic drainage has been really a big game changer for a lot of our patients, like post-op, post-egg retrievals. Like it's so beneficial and really just to kind of aid in like digestion function and things after, especially after anesthesia, when
Mm.
things just aren't working as efficiently. But for those of us that haven't had lymphatic drainage, would you be able to kind of give us a little bit of some background on what lymphatic drainage is, how it works, and some of the benefits of lymphatic drainage?
Yeah. So lymphatic drainage is based on the lymphatic system. It's one of the bodily systems that, from my understanding, is like newer in discovery, which is still within like, the last few decades or so. But like if you were growing up learning the different systems, it wasn't necessarily one that they delved into, and it was very brief. But the lymphatic system, it actually is like basically like part of the body's immune system, like a huge part of it. Um, the lymphatic system, it is like kind of like the highway of like waste disposal for the body. So basically, like, with the whole body, we have all this fluid, we have all these things going on inside besides just like organs or systems like that we studied, like thinking about it in like bones only or muscles only or like the heart and the circulatory system only. Like we forget that everything is connected and that there's a lot of space in between it. So all that little space, there's just what they call like interstitial fluid. So there's just a lot of that like in the in between of all the things that we know of. And what we don't know is that every time like the circulatory system goes around, there's about like 10% of it that actually goes into and filters through the lymphatic system, where the lymphatic system actually cleans up everything in there. So it's like excess cell debris, just like waste or toxins that the body kind of accumulates, excess fluid. And so that kind of gets circulated again, and then it's like processed out through like the bowels, the lungs, the skin. And it's just like that part of the cleanup process. And so immunity is such a important function of the body, but we kind of haven't heard as much about the lymphatic system if you didn't grow up learning about it or studying it. And so the massage itself, it was originally discovered and created by Dr. Vader. So he and his wife, I believe they're from Switzerland, created it. And it's a very gentle technique that works on almost like rhythmic pumping of the lymph node areas and then a gentle coaxing of the fluid towards the lymph node areas. I actually have a little image that I would like to share that kind of shows like that flow. Is that okay for me to go ahead and
Yes,
show? Okay,
please.
let me share my screen real quick. Uh, so this right here, if everyone can see, is kind of like the flow of the lymphatic system. So there's more accumulated lymph nodes in certain areas like right here, what they call the terminus, like underneath the clavicle, in the axillary area, so like the armpits. There's a lot in female breast tissue, and then there's another main one over here in like the inguinal area. There's actually a lot that goes on in the abdomen as well, and that's why lymphatic work is a lot of abdominal massage as well. And so Dr. Vader, when they first created it, they basically pump these lymph node areas, and then using very gentle superficial techniques, they coax this liquid, this excess fluid towards these areas where the lymph nodes then process, break down things. So if you have any pathogens, anything in your body, like that's where it gets processed. And then it kind of circulates through the structures in the abdomen, kind of coming up. Like there's a organ over here called the cisterna chyli, and it kind of goes up and it goes over to like the thoracic duct, which would be here, not really shown on this diagram because it's just showing the flow of lymphatic fluid, but that's where it kind of empties back into the heart, and that's where the circulatory system and the lymphatic system kind of work together like that. So that's primarily what manual lymphatic drainage massage looks like nowadays, which is abdominal work, pumping of the lymph nodes, and the coaxing of the fluid towards these areas to be processed, which then later the body will eliminate through different areas, kidneys, bowels, bladder, all of that. And nowadays, they have even more forms of technology that can improve that lymphatic flow. So stuff like the Lymph Star Pro, which is like a machine that helps to actually increase the pace at which the fluid can move towards these lymph nodes. Those are all parts of what lymphatic drainage has kind of turned into today. So there's like lots of cool things, technology that kind of helps with just manual technique now.
Yay,
I'm going to stop the
technology.
share.
Yeah, so as far as the combination of the two, is it something that you are able to practice together with the technology of the like the Lymph Star Pro, for example, with manual lymphatic drainage?
Yeah, definitely. I mean, it's actually even recommended to do both, depending on what the person's body is telling them that they need as well. The Lymph Star Pro actually enhances the flow of lymph sometimes by like 800 times. Also, that's what the producers of the Lymph Star Pro say as well with their research in their machines for a couple decades that they've been enhancing and improving this technology. And when
That's a
as a
huge
practitioner,
improvement. That's
yeah,
like 800 times is a lot.
yeah, it is. But as a practitioner, and especially coming from like a holistic field, I am not one to say like more is always better. So I
Mm,
always think it's a
mhm.
good balance.
Sure.
So it would be like if it's like your first ever lymphatic drainage treatment, I would usually do like a combination of both in specific areas for like the LET, the Lymph Star Pro, just to make sure that like any areas that feel like they're congested get like the extra help to kind of
Mhm,
break up that, because that's really what the LET helps to do when it does its technology. It's like a electrostatic like vibration technology.
mhm,
So it can help break up that congestion, and then the MLD, manual lymphatic drainage, so the hand techniques can help move it towards those areas. So beginners, first time lymphatic drainage treatment receivers, I'll recommend a combo, but
mhm.
that actually sometimes even just manual lymphatic drainage itself can have powerful effects, or just the breakup of the congestion of the lymph nodes with just the LET can help as well. It's always finding like that balance depending on
Right,
what you're
right.
needing.
Okay. Well, thank you. That makes a lot of sense. I had a question that kind of came up while you were describing lymphatic drainage, and I'm just curious. I'm sure a lot of patients ask this question too. What causes the congestion in the lymph system?
That's a lot of different things. Um, but if we're looking at something that's like chronic, sometimes it's like autoimmune conditions,
Mhm.
sometimes stuff like Lyme disease or like mold toxicity. Um, like that's some like even like psoriasis or like things that have more of like the autoimmune
Yeah,
condition in the body, like those can
right.
put a load on you, especially because it's affecting the immune system. So if it like kind of affects the immune system, then the lymphatic system is obviously affected. And so like receiving treatments can help kind of boost that. There's also like physical ailments. So like if you have very tense muscles, sometimes the flow isn't moving as efficiently, especially if you're more like sedentary. Like if you're really tense, but then you're like always running or something, like the movement of the lymph will be different than like if you just have like technic muscular tension, because the lymphatic system doesn't have like a natural pump like the heart, like with the circulatory system. There's research that says like sometimes they have like little tiny lymph hearts called lymphangions that will kind of pump it as well, but it's more or less moved actually by movement of your body and like deep abdominal breathing. So if you remember the image of like the abdomen, actually like the cisterna chyli right underneath the sternum in the rib cage, if you're deeply breathing, that will help pump it. And if you're moving, like walking, jumping, exercising, that kind of helps to pump the lymphatic fluid up and out. So something as little as that, or like sometimes like an injury can damage the lymphatic system,
Mhm.
and it's just like causing the lymph to have to divert itself to a different area. So
Mm.
that's why sometimes some like limbs or certain areas like a hip can get excess swelling, because there may be something that's kind of happened to the lymph system and the lymph nodes there. Then there's also surgery. So if you've
Mhm.
had like a mastectomy, or if you've had any surgery where you've got lymph nodes removed, or any surgery in general where they're cutting through and they could have damaged it because it's a very delicate like system in the body, that can also cause swelling and congestion. So there's a lot of different things, but
Okay. And I'm sure even just like day-to-day acute injuries too, so not just
yeah,
chronic
yeah,
conditions, but it sounds like the top things would be like autoimmune issues, chronic illnesses, or chronic inflammatory conditions.
yeah,
Patients have a propensity to have more congestion in their lymph system. But it sounds like everyone can use lymphatic drainage. I'm
yeah,
sure that we all have congestion in different areas that build over. It's kind of like when we talk about qi stagnation in Chinese medicine, we talk about how
yeah.
our meridians get blocked. So I
Mhm.
keep thinking about like, oh, the lymph system's like the channels in our body. So we
Yeah,
want it to be like an open freeway with no traffic jams, to have
yeah,
like optimal health. So these are the things that aid me in my understanding of things. So,
yeah. Like for the
um,
average person, there's like a lot of environmental factors,
yeah.
like pollution, like
Mhm.
allergies, sinus issues, just like even just like I don't know, like
Santa Ana
microplastics.
wins.
Yeah, like there's
Mhm.
just so many things that could be in there, and so for like the average person that doesn't really have any of the other symptoms like injury or anything like that,
Mhm.
like something as little as just living in your body, and you have muscle tension, then you don't like move enough, like that can be part of like the stagnation as well.
Okay, that makes sense. So what's the big difference between LET and manual lymphatic drainage, would you say?
I would say the biggest difference is, well, manual is a manual technique with using hands. So, that in itself is going to be a different type of like experience for receiving lymphatic drainage. The LET is a machine, so um, it looks kind of like this. Actually, let me show you again. I'm sure share my screen. And this is what it looks like. So this is what the machine basically looks like. And what it looks like is actually it's got like these wands that you would put onto the body and over specific areas where like lymph nodes are. Like this is the example of the terminus, like underneath the the clavicles here. And so this actually uses technology to basically speak to the lymphatic system. So it has like a electrostatic and like sonic is what it's described as, like waves that go through.
Mhm.
And it's at the frequency that is meant to speak to the lymphatic system. It like pulses like at a rhythm that is faster than what you would be able to do with your hands. So it's like an increaser, accelerator of
Mhm.
moving the congestion and breaking it up.
Okay, that makes sense. But having both of those treatments done, I feel like they're both really relaxing and kind of get you into this surrendered state or into like a parasympathetic state where you can
Yeah.
relax. I mean, you almost start feeling like your eyes get kind of heavy during
Oh
treatment.
yeah.
So
Well,
I have a lot of questions for you, Caitlin, but
uh-huh.
I wanted to ask a few and then open it up to questions from other people too. Of course, my questions are going to be a little bit sided towards acupuncture and kind of like the collaborative treatment of the two. So, what are some of the benefits of combining lymphatic drainage massage with acupuncture?
Well, so lymphatic drainage with acupuncture is actually really nice because as an enhancement to acupuncture, it can help balance the body's like energy or chi. So it can reduce pain, it can improve your overall well-being. Um, it acupuncture, like the meridians are, comprehensive all over the entire body. And when you're working with the lymphatic system, it's and as you're moving all the different like the different things like lymph, blood, so circulation and like oxygenation through the entire body, that can also affect and help with the different points. I want to ask Dr. Yang specifically when you actually uh, provide Lymph Star Pro with your acupuncture visits or sessions with your patients, what specifically is it that you're like, oh yeah, for sure, I would recommend this for you.
You mean in terms of who I think is a good candidate
Yeah,
for a Lymph Star Pro or manual lymphatic drainage?
the Lymph Star Pro with
Mhm.
acupuncture.
I would say so. As you know, we do a lot of fertility support work in the IVF space. So, one of the areas that we refer out to you a lot for is post egg retrieval. So, in that time, patients can be swollen from the procedure itself. A lot of inflammation occurs. A lot of it is from the medication too. You're basically hyperstimulating the ovaries to produce several follicles and mature, more than normally we're maturing one egg at a time. But when you're doing an IVF cycle, it could be 10, 15, 20, 25 follicles developing and growing at the same time. So if you could just imagine the inflammation that can occur as a response to something like that, and then going in for a retrieval where they're going into the ovaries to extract the eggs too. So we usually recommend LET in combination with manual lymphatic drainage to help with swelling, inflammation, and constipation, which is very common after any kind of surgery, really. The other things that I look at are any type of swelling or edema that's chronic for patients, and then liver detoxification support. So if a patient is really trying to work on eliminating some prolonged use of medications, antibiotic use, they have chronic GI problems that they've been dealing with, and maybe they were prescribed many rounds of antibiotics. Those patients would be a really good candidate for lymphatic drainage too. So those would probably be my top ones. And I've actually noticed that it's been really helpful for allergies. So a lot of our patients have been saying that they feel a lot less congested, less swelling. They even say their face feels thinner after you work on their sinuses, and their, any kind of swelling in the neck also goes down. too.
Mhm.
So that was kind of a nice surprise. I wasn't expecting that, but some of the patients that I see for
Yeah.
allergies are like, "Oh, my digestion improved. Plus, my allergies on my neck is thinner now." So, so a little side benefit, I think,
Yeah.
of
I get
reducing
the glowing skin
inflammation.
a lot. That
Glowing skin, yeah,
Yeah, I think,
nice.
like, the side effect of it kind of oxygenizing, like, the
Mhm.
skin and helping to, like, remove, like, the pollution that's kind of, like, there, like, things you
Mm,
don't really think about, like, because you do your skincare, but, like, being able to, like, clean it out from the inside, like, through the
yes,
skin and out,
nice.
that's just something that people are like, "Whoa, my skin is so nice after this."
Yeah, no, that's a great point because then, I mean, if your digestive system is better and if you're, eliminating toxins and filtering things through your, through your pores, through urine, through digestion, it's like a little mini detox for your body.
Yeah.
And then hopefully all of our patients will continue to eat a very nice anti-inflammatory diet too. To
Yeah,
continue that, to help that healthy glow continue for their skin.
yeah.
So, but
It's
that's a
so
great question.
detoxifying that, like, if you don't eat well after, you'll feel it, like, your body will tell you that it
Mhm.
did not like that.
Right, right. And I do want to say the other thing that I've been referring a lot of patients out for lymphatic drainage is chronic skin conditions, rashes like psoriasis or eczema. That's pretty stubborn. And majority of the patients say that it's the itching is so much better and they have less breakouts. So thank you for helping patients with the chronic skin conditions.
Yeah, it's,
So
like,
that's
anti-inflammatory, so
yeah,
that's
I think
that's
that's pretty
great.
remarkable though to be able to see a difference after one treatment.
Mhm.
For
Yeah.
especially for folks that have been dealing with it most of their lives. So,
Yeah.
yeah, so those would be my top things. That's a good question.
Yeah.
So what can a patient expect during their session with you?
Um, so what to expect during the session, is, very light work, very gentle, relaxing, treatment, and, depending on whether or not we're doing the Lymph Star Pro LET therapy with manual lymphatic drainage, um, sometimes if you are receiving both, you'll actually feel like a deep relaxation on the table and then a little bit of like energizing after. But you just gonna lay there, you almost fall asleep, which falling asleep is the best because your parasympathetic state is like
Mm,
helping to move it the lymphatic like the lymph fluid even more. So like fall asleep on the table. Try like please.
nice. Don't fight it if your
Yeah,
eyes start
don't
to
fight it if you
close
get
and get
sleepy.
heavy. Yes.
Yeah, because it makes it even more detoxifying. And then either it's like very gentle manual techniques, which I kind of demonstrated with like a little of light pumping in like lymph node areas, and then like a gentle coaxing of the fluid towards those lymph nodes. It's kind of like a very gentle skin drag. I wouldn't say that it like never feels pinchy or anything, but it is not supposed to touch the muscle layer too much. It's like skin and then like lymph fluid, like the clear fluid that's kind of like when you get like a cut or something, it kind of comes out like, and then it's like muscle. So a lot of people get kind of surprised that it's like not tackling muscle. And there's other lymphatic drainage massages that will say they do like lymphatic drainage and it's a muscular one. Those are maybe different types of them, but at least with like the original like Vater technique one, it was not meant to be like that. And LET therapy as well. Like it you saw like the picture of the wands, like that's not gonna be heavy pressure on you or anything. It's
Hmm.
like a light glide
Right.
on the skin.
Hmm.
Yeah.
So aside for someone, besides the conditions that we discussed in terms of what conditions can benefit from LAT or manual therapy, are there any other conditions that you tend to treat pretty
Mm,
commonly or frequently?
I would say like fatigue or pain. Like so
Mhm.
sometimes like you have kind of like sometimes even like arthritic pain or anything like that. Like um and then like sometimes it can actually reduce that pain for you. And it might be part of like the process of inducing the parasympathetic state and being able to kind of calm the body and like make it more anti-inflammatory in that way.
Mhm.
So those are like pretty common. The fatigue, like right before you get sick, like if you feel like you're about to be sick, and then if you don't have like a lot of the symptoms yet, but you can kind of tell like with like low energy, brain fog, all of that, like the extra boost of immune system functioning with the lymphatic drainage treatment is common for when I'll do it as well. And let me think. I think
What ab
even like anxiety, stress, or like
mm,
depression, because
mhm,
that type of relaxation and being able to like come into your body and release like what you're holding on to mentally and just have like a peaceful rest. Like I think that one gets not as seen. It's kind of like underrated because
mhm,
they're just like, oh, it's
right.
just relaxation. But like people are nowadays beginning to learn that relaxation is actually vital. It's important, like, because in a highly stressed world, like, why do we have all these chronic conditions? You know, why are
Right.
there so many things popping up, and also why are we never relaxed?
Yes. Well, because 'cause we're always on the go, and it's very rare
Yeah.
that we're pausing and we're actually still. And I think lymphatic drainage, just like acupuncture, is what some of my patients used to call forced relaxation.
Yeah.
Because you 'cause you can't really go anywhere, especially with needles in you, but with lymph
Yeah.
drainage too, right? You're in one spot,
Yeah.
which is really good because then your mind has to calm down and, your nervous system just naturally starts to downregulate. So
Yeah.
it might take a couple minutes before it can do that, but I agree with you. Just having that self-care time and where you're not thinking about the next thing you need to do or what else you need to
Mhm.
cross off your checklist can be
Yeah.
really vital for
Yeah.
for
And like,
relaxation and supporting your adrenals too.
oh yeah, for sure. I guess one thing that's unique about lymphatic drainage therapy is like, I guess when people get like a typical massage, they're usually like, "Oh, it feels so good during." And then like
Mhm.
I feel great after, but then like it always comes back kind of like
Right.
a feeling. They're just kind of like when they think of a massage, I think of it have of occurring between hour one and like, maybe like that one night.
Right.
But lymphatic drainage continues because you've now increased the flow. It can increase for several hours, like even like 48 hours after. And I've had even without the LET, just manual technique. I've had patients feeling the detoxification effects for up to like 2.5 weeks. And it just
Mhm.
depends on what they're detoxing. So like
Right.
it kind of lasts a good amount of time, especially if you're doing all like the aftercare for it, like drinking the water and doing like light movement and processing whatever's coming out, whether it be like
Mhm.
physical, like elimination, or if it's like subconscious things that you're holding on to, emotions as well, like that's all being processed and it's part of it. And that's why I love lymphatic drainage. Is again, it's got the clinical like physical part to it, but it's got the emotional spiritual as well if you want to tap into
I love that.
it.
I'm all about that. Well, you mentioned something about after session care. So can you
Yeah.
tell us a little bit about that and how patients can get the most out of their treatment and get that ongoing, enduring effect from lymphatic drainage?
Yeah. So after you have the treatment, most of my patients are feeling like so parched. Like they'll be
Mhm.
like on the table and I can hear them like I'm like so dry in my mouth now and in my throat. And it's because like things are being drained down to these areas that they're being processed. And then a common one too is like they're like, I have to use the restroom after this.
Right.
Because it's just like it needs to get out, And so all of that elimination of like physical fluid needs to be replaced. And it's a very like water fluid based system. So if it's moving at a faster pace, but you're not drinking enough water, or you're not properly hydrated actually before the treatment, you can kind of feel like detoxification effects, like headache, like that dehydration kind of thing. And so you have to drink a ton of water after. You don't have to, but you kind of get very strong detoxification effects after. And that's no bueno, not fun. And if you want to continue to have the lymphatic flow going and kind of even trying to accelerate it, sometimes if it's appropriate for you, you can go to like a sauna, and then you can kind of release more out, and you can take like a bath with Epsom salts. You can walk. So walking is again like that movement, moving the muscles. They call it rebounding, which is like kind of like a little bit of a jumping. So if you have like a mini trampoline or like you're jumping rope for a little bit, that's rebounding. So that's actually
Mhm.
going to help a lot with lymphatic flow. And then dry brushing. Dry brushing is actually one we haven't mentioned yet. It's you can actually buy like dry brushing or dry brushes, and then you can brush using like the flow chart that we were showing earlier, and you can actually do it and think about how light it is to just kind of brush the skin. Some people are like, does it even do anything? But if you actually felt the treatment, you would know how light it is too, because just anatomically, it's so superficial, so light. And we kind of forget that even gentle techniques can be super powerful. So
Mhm.
that's like the best way to take care of yourself after eating well, no alcohol either, for
Mhm.
at least 48 hours.
How soon would you recommend that a patient go for a sauna treatment or an Epsom salt bath after a lymphatic treatment?
I would say if they're not feeling too strong of any like effect after, like if they're like, whoa, I need to go to bed right now after this, probably not that same night, maybe the next day within
Mhm.
like the 48 hours. But if they're like,
Okay.
hey, I'm feeling good, I want to keep this going, I'm feeling energized, I think I'm gonna try to like let it continue to like come out, then you're doing like both sauna and a bath is very relaxing and it can kind of put someone who's in like a type A personality, a very like go, go, go thing to like a mentality of, okay, let's let more rest happen and
Mhm.
more like more purging of like whatever toxins were in our body.
Okay. Awesome. So, yeah, that's great. I think that it's a good reminder for everyone. Actually, a lot of those tips are really great after any kind of treatment, I think, any kind of self-care treatment, whether it's acupuncture
Yeah.
or lymphatic drainage or any type of massage,
Yeah.
just drinking a lot of water, taking it easy, and just, self-care, I think is always great advice. So, as far as treatments for, I did have a question about conditions. What type of benefits can somebody see that's having like hormonal imbalances or like menstrual issues? Is there anything that you've seen that lymphatic drainage can address specifically?
Specifically, I think for women who have like painful menses, it can ease the pain for that
Mhm.
as well. So it's again like the pain
Nice.
management. Um, it's it's an interesting modality and that can also help increase the flow of your moon cycle.
Hmm.
Um, there's even a story that actually, Dr. Ying, you and I've heard where someone uh, had the lymphatic drainage treatment, and then they had like one period after, and but they were actually like perimenopause, and so like it was just like a one-off thing that was like, whoa, like that detoxed out. Like they just had one singular period when they were
Right. Right.
perimenopause.
It's like a cleansing of the uterus that needed to
Yeah,
happen one
and
more time.
yeah, and so it's
Mhm.
like a whew, come on out.
Yeah,
And
that makes
so, yeah,
sense.
so it can help ease a lot of those things. And like when it comes to like hormonal balancing, um, well, whatever it is that could be the source of the imbalance could also be balanced by trying to release what isn't necessary. So it's kind of all part of it. There's different areas that you can add or put like the Lymph Star Pro, the LET, to like specifically address adrenals and everything too.
Mhm.
So
That's
it's very
great.
calming effect. Yeah.
Right. And I'm just curious too, because in our practice we see a lot of polycystic ovarian syndrome, which is anovulation, irregular menstrual cycles, things like that. So
Hmm.
I'm really curious to see how the effects are. I mean, it's still something that's quite new to introduce the LAT to our clinic, but I even think with the manual lymphatic drainage, patients have noticed like regulation of their cycles. So I'm interested to see how adding the LAT or the Lymph Star Pro, how that's going to affect irregular menstrual cycles and things like
Yeah.
PCOS. So
Yeah.
we'll keep you all posted. We're keeping tabs on that and seeing what the anecdotal data is like between, the combination of acupuncture and lymphatic drainage. But I will say, patients that get the two together, they really love it, whether it's, tagged on the same day or if it's like within the same week. So yeah, so I have a question that just came up. How does it help with getting over an illness and immunity boosting? And I know you talked a little bit about this earlier, but maybe if you don't mind expanding on this a little bit more.
Yeah, thanks for the question, Jennifer. Nice to see you.
Thanks. Nice to see you.
Yeah, so like just thinking about the lymphatic system in the lymph nodes, it's actually like they have the B cells and the T cells for immunity. And as more, almost like imagine like a room with like a capacity limit, like 40 people max. When everything gets kind of flushed towards the lymph nodes, it kind of swells and there's more stuff, there's more things, more people in the room going on, like the capacity is getting full, and that'll kind of make the body know to like increase more of the B cells, T cells. And so that's like the immunity boosting part that's occurring in the lymph nodes where they're trying to like break down those pathogens or anything that could be in there that could be making the body ill. And then all of that gets like broken down into little bits for it to be like kind of flushed out. And so when you're getting a lymphatic treatment like right before illness, then it's really nice to kind of get that extra B cell T cell count in. And like then after an illness, it's also nice to flush whatever hasn't come out yet that it's still kind of lingering. And then let me double check your question. Like, does that answer everything? Was
D-
there?
Does it also help with allergies? Like I had a
Yeah.
cold a while back, and then I developed allergies again. Okay.
Yeah, it should, because it helps with the sinus clearing as well. So there's definitely, it addresses all of that for sure.
Thank-
I can attest to that for sure. I have chronic allergies, and my allergies are
Yeah,
much better when I have lymphatic drainage. I've
yeah.
actually had patients that have autoimmune issues, specifically more like autoimmune thyroid conditions that tend to have, colds frequently. They're easy to catch colds. And once they started lymphatic drainage treatment, their immune function was so much stronger. And I wasn't seeing them get sick as often. And, they would get sick maybe like once a year instead of like every couple months. So I have seen quite an impact made with lymphatic drainage for supporting the immune function.
Hmm.
So, yeah. And, I'm not having to like prescribe as many Chinese herbs to combat those colds and those allergies as much, which is nice. One less
Hmm.
thing to take. So
Yeah,
another question came up here. Would the lymphatic techniques help with gout? Ooh, that's a
that's
good
a good
question.
question. Yeah, Jinx. Well, so um I haven't treated gout yet, but from my understanding, gout is like a type of inflammation, correct? And it's like almost like a type of arthritis. It's like it's also, isn't it also related to foods as well?
It can be exacerbated by certain foods you eat, anything that
Hmm.
elevates your uric acid levels.
Hmm.
So generally, like alcohol, beer, um, red meat, and shellfish and seafood
Hmm.
tends to elevate those markers. And the uric acid levels are usually higher in those patients. And
Hmm.
commonly, the gout will show up in like the big toe, sometimes the ankles.
Hmm.
I've seen it even kind of travel up a little bit further too.
Yeah. Um, just double checking then. With gout, there's no type of like blood clot or anything like that, right? Like there's some
Not
swelling, but there's
not
there's
usually.
nothing,
No,
yeah, there's
there's
nothing related to that.
no.
Then yeah, just based on the description of it, then yes, it sounds like lymphatic drainage would be able to help because it has the excess swelling. It's clearing out also what probably triggered the inflammation. And if it is, if it's a diet related one, it's also part of that process of the detoxification. Yeah, sorry. And yeah, so it's something that I haven't personally treated yet, but I think it could.
Sounds like it's definitely worth a try.
Hmm.
Especially if you're able to affect joint pain. I think I think gout would be worthwhile to try to get some relief with lymph
Hmm.
drainage, especially the LET
Yeah,
device.
definitely, especially that
Hmm.
decongestive aspect of it.
Hmm. For sure. So we have another question. Would lymphatic massages help prior to surgeries?
Oh, definitely. Yeah.
And would it help for a surgery that was done previously, like almost 10 years ago, that might have some residual pain? This is specifically more for jaw surgery with residual pain and tightness.
Yeah, actually, that's actually one of the main draws of specifically the LET, the Lymph Star Pro. Actually, dental surgeries
Hmm,
or dental pain is actually a huge part of it that a lot of people don't know of. Because it can
interesting.
actually, yeah, like it can work through the different areas of the face here. Like, and so you have like toothache pain or like TMJ pain, that can definitely do it. And so even if it's an old one, like if it's something that's been occurring, or like even if you have it for like 10 years, but it's like a chronic type of like tooth pain or anything, like there's definitely been studies that shows like the results from being able to tackle that type of pain and inflammation that will be in there. Of course, with everything, it takes a couple sessions. It's not like a one time you receive it and then you're like, oh, all my pain is gone. That would be really lucky, you know. That might be something that's like not as like lengthy of like a
Hmm.
chronic pain, but usually something like that's specifically what LET is used for as well.
Nice. Thank you for that question because I didn't even think about it for dental pain or
Yeah,
like post dental procedures.
yeah.
So that's good to know.
It preps the body before surgery. So like
Hmm.
it gets the lymphatic system going, the immunity going, so that when surgery occurs, then there's already like the cells there that are like, I'm ready to go.
Right,
And then
right. That makes
afterwards,
sense.
it helps as
Hmm.
well.
Hmm. Is there a certain time frame that you would recommend patients to come in prior to a surgery and then post-operatively too?
Prior to surgery, probably like at least like 1 to 2 days prior, maybe three. It's better to
Hmm.
do it like pretty close to surgery time. So like, because it's usually like around like the 48 hours for like the full like effects of that increased flow to be occurring. Post surgery, it depends on the type of surgery, also the doctor's clearance for it. Specifically, like I've seen like maybe 1, 2, 3 days post-op, and then also after clearance, sometimes even like 1 week, 2 weeks, just depending on
Hmm.
what it is.
And
Because
what type of surgery it is?
yeah,
Yeah.
just also if you have certain conditions that don't allow you to, like if
Hmm.
you're at risk for blood clots
Right,
or
right.
something like that, like that's contraindicated. So,
Okay.
and that
That
would
makes
happen
sense.
sometimes with surgery. So that's
Hmm.
something that the doctor would need to clear.
Okay, sounds good. Well, and how about like post C-section, postpartum?
Yeah.
Again, same thing,
Yeah,
clearance.
same thing. It's more
Hmm.
if there's a risk for blood clots, then you would want to be a bit more careful with that and kind of check in with the doctor to make sure that like they didn't see anything like that.
Okay, that makes sense. Okay,
Hmm.
thanks, Caitlin.
Yeah.
So we have one more question here. Is lymphatic drainage safe during pregnancy?
Different forms of it. So, I would say that some people do choose to receive like the Lymph Star Pro and manual lymphatic drainage during pregnancy. It is a detoxification like modality. And so I think for pregnant women who have like absolutely no like complications or anything, there's usually like no there's no like issue with it because there's no studied link between any type of lymphatic drainage and like any loss of pregnancy. So it's more of a precaution during pregnancy, more because it hasn't been studied about
Hmm.
that. But
Okay.
in general, being able to receive any type of deswelling lymphatic drainage is fine during pregnancy if it's not in areas that would like induce labor, for example, or anything like that. Like a pregnant woman who is like post 22 weeks isn't really meant to be laying on her back. So then the lymphatic drainage would be slightly different because it would be side lying rather
Right,
than like
right.
front, and you wouldn't want to be laying forward on your stomach prone, even
Well,
with like a
that's
cutout.
probably the time when you really want to get some kind of lymph drainage is usually in the
Exactly.
third trimester when you're
Yeah.
feeling more swelling and discomfort.
It would just be
Mhm.
in a different form in that it
Mhm.
would be more like a Swedish technique with the manual pumping of like the lymph nodes, because when you're doing massage you are moving like blood, you're moving lymph, you're moving all these
Mhm.
things and you're touching muscles, so it is moving lymphatic drainage. But if it's like specifically, I don't know, like, so it's something that's meant to detox strongly, like then like at that point it's like there's probably better options that are more targeted for like the swelling of the limbs, that are safe, and also would be like more balanced for it.
Mhm.
So that's why
Right.
usually when I do any type of pregnancy manual lymphatic drainage or lymphatic drainage in general, I'm not using the LET, at least with the lymphatic drainage on a pregnant woman, but I am doing manual techniques and doing like Swedish like strokes that move the lymph towards the lymph nodes to be processed. So it's just like a different form of doing
Sure. Well, that sounds really relaxing and nice
it.
for pregnant women. There was another second part to this question. When can you start postpartum?
Postpartum, whether or not you are doing or if having a vaginal birth or a C-section, you can probably do it like as soon as you're cleared. So you can even do it, you could probably receive it, like especially like if it's like a surgery, like C-section, the 1 to 3 days like after giving birth. It's just a matter of, again, the blood clots and your clearance for that.
Mhm.
And so if that's all clear, then you can pretty much have it right away. I think specific work over any type of C-section scar is probably later, maybe
Mhm.
about like 6 to 8 weeks.
Right.
So that would take more time. But of course, like all the swelling that's happening like right after birth as well, like I would say that's a good time to come in. Like just as long as you can sit without pain and like be able to receive the treatment, um, then it should be okay.
Okay. Sounds good. Couple of other questions. So many good questions. What can I do daily to self-maintain my lymph system, and how often would you recommend a lymph drainage session? That's a two-part question.
Yeah. Well, so if it depends on where you're currently at. So if you're like a general wellness person, that you don't have any kind of chronic condition and you're just like just trying to move your lymphatic system in general, movement is one. Two is deep abdominal breathing. So being able to um, belly breathe, kind of like right where you place your hand on like the top of the tummy, like near the abdomen, under the sternum and the rib cage, like right there, practicing to like inhale and feel that come out, and then exhale, feeling it come in. Like that's literally pumping the lymphatic system. And yeah, just rebounding. So like the trampoline and going like 10-20 minute walks, just anything to kind of get it moving. And you'll see more of it if you're not already doing that. But if you're already pretty athletic, already like doing a lot of things, then you can probably try like dry brushing, or like continue to drink lots of water, even sometimes elevating the feet if you're feeling like you have some type of swelling in like the knee or anything, and kind of doing some small like self massage in like the lymph node area.
Nice. It sounds like you might need to give a on another workshop or do a demo on dry brushing.
Yeah.
Yeah, because
What was the second part of the question
the
again?
second part was how often would you recommend a lymph drainage session for maintenance?
Okay, for maintenance, maybe like once a month if it's just general wellness maintenance.
Okay.
You can go as often as 2 to 4 times a week. Like that's that's common in with like even like the LET as well, with just different variations of how much you can have, like time wise for LET, just to track the progress of it. But generally our patients are coming in once a week, once every 2 weeks.
Hmm.
It just depends on what you need, especially since a lot of our patients are receiving acupuncture as well, and not just solely
Sure.
lymphatic drainage.
So if it's a condition that you're treating specifically, like a pain condition or something like somebody had a question about migraines, would
Mm-hmm.
you recommend like a series where they come in more frequently?
Yeah, if
Okay,
it's an
so
acute thing. Mm-hmm.
okay, so what would that look like for something like migraines?
Um, Generally, for something like migraines, we would probably try like 4 to 5 sessions. So like maybe once a week for like 4 to 5 weeks.
Mm-hmm.
If it's like if it's pretty intense of a migraine that is like even after the first session that you feel like you're not getting too much of a change, I would even do like twice a week for four or
Mm-hmm.
five sessions
Okay.
just to kind of track it. It's like as we go, we kind of see like, hey, how did this session affect it? And we want to kind of adjust how it is. Like sometimes we recommend 4 to 5 and they only need like 3 because
Nice.
it's
That's
good.
always ideal.
Yeah.
Yes. Yeah.
Yeah.
Results, quick results.
Yeah.
So have you seen lymphatic drainage help to like cure or maintain migraines and chronic headaches?
I personally haven't seen it because we've newly kind of introduced the LET to the clinic.
Mm-hmm.
But I definitely know that there are the anecdotal stories of it with
Mm-hmm.
the migraines because it depends on what the source of it is because migraines can kind of come from different places as well.
Mm-hmm. Right.
So I would say yes, that like it can work towards reducing the pain and even sometimes like kind of curing it, but we just can't guarantee based on like, this many sessions will cure it because it just depends on what is the source of it. And so it can definitely help reduce it.
I think migraines can be really tricky. Treating
Mhm.
migraines for over 20 years, I think the sources are usually hormonal, stress, food sensitivities. Those are the big things. Sometimes even allergies can complicate the migraines too. So I agree
Muscular
with you.
tension.
Yeah, yeah, it just depends on what's going on. But I think given all the areas that lymphatic drainage hits in terms of like down regulating the nervous system, so it'll help reduce stress and tension in the body, and
Hmm.
then also helping to balance the hormones too. Like that all makes sense to me that it would be really helpful for hopefully preventing migraines from coming on too. Sometimes
Hmm.
migraines are tough because once they start, there's like no turning back. They come on with a
Yeah.
vengeance, and so being able to kind of catch it either in the beginning or preventing it from even happening is probably key.
Hmm.
So for those patients, I think that get migraines around their period, I usually try to time their acupuncture treatments prior to it, like sort of in that premenstrual phase or even before, so that we catch
Hmm.
it. And I'm sure lymphatic drainage would be the same too. So hopefully that answers your question.
Yeah.
Were there any other questions about lymphatic drainage, either manual lymphatic drainage or LAT, or anything about massage, really? Any of the
Mhm.
modalities? Okay, while people are thinking, I'll ask you another question.
Okay.
So what do you have coming up, Caitlin? Anything exciting? I know you're always getting educated and you're a continuous student, which I love about you. So just curious to know, is there anything coming up for you? Anything new that you'll be adding in 2025?
Actually, yeah. I am going to become a practitioner of the Arvigo mind abdominal massage.
Ooh, yay.
So I'm super excited to be able to offer that at the clinic in 2025. And yeah, that's working directly over the abdomen. That's supposed to like we haven't reached this part yet with the education, but it's going to be able to help kind of explore like the anatomy of also what's going on in the abdomen, even like uterine positioning. And
Mm,
so being able to work through that, and it's like a very deeply spiritual work as well. So I mean, I looked at different things like visceral manipulation and like other like fascial based modalities, but the mind abdominal massage is like, it's very connected to the soul, the spirit. It's a very vulnerable place for people, and especially at our clinic with like the stories, the past, the history, and the hopes for the future. It's a place to work massage in a very like connected, gentle, and like giving way. So that's something that I really am looking forward to being able to provide in 2025, because I think it'll be really nice for people to receive that and release what they don't want anymore in such a place that will hold so much, in the future and currently for them.
That sounds amazing. And it sounds perfect to add to your practice and to your toolbox of cool things that you offer your patients. So I know that I'll be sending a lot of patients to you for that. All right. Well, everybody, thank you so much for joining us tonight. I hope that this was helpful information for all of you. And if you haven't tried lymphatic drainage or any of Caitlyn's services, she's an incredible massage therapist. So please stay tuned for all of the new offerings she'll be providing in 2025. And if you missed any of this talk, we'll be releasing it on my podcast, the Women's Health and Fertility Podcast, as well as on our YouTube channel. So you can catch it again or share it with some friends if they weren't able to make it. Everyone's so sweet. Thank you guys for all of your kind messages.
Yeah, this is awesome.
All
Oh,
right,
it's so sweet.
everybody. Thank you, Caitlin, for your time, and thank you everybody for spending part of your evening with us.
Yeah. Happy Tuesday, everyone.
Happy Tuesday. All right. Have a great evening.
Yeah.
Bye.